everybody, welcome back to the series of NEET MDS 2021 Recall. In this video, we are going to see about traumatic myositis ossificans from the subject Oral Medicine. So what is traumatic myositis ossificans? So we can see from the title itself like traumatic. Traumatic means it is associated with some trauma. Okay. So myositis and ossificans, what does that mean? So let us see what does that mean. So myositis ossificans is a condition where bone tissue forms inside muscle or other soft tissue after an injury. So what does myositis ossificans mean? It is a bone tissue that forms inside a muscle or any other soft tissue after an injury. So when this is associated with any kind of trauma, that is called as traumatic myositis ossificans. So it tends to develop in young adults and athletes who are more likely to experience traumatic injuries. So the common sites include pectoralis major, biceps and thigh muscles. Of course, these are the muscles most commonly injured during a sport. Then coming to the cause. So the cause is a single traumatic injury. Okay. So repetitive injury to the same area or a single traumatic injury, both can lead to traumatic myositis ossificans. So regardless of the cause, it happens when the body makes an error in the healing process. Of course, when a soft tissue injury is happening, and instead of that soft tissue getting healed over there, if a bone gets deposited over there, so that is a problem. So that is what is traumatic myositis ossificans. So as you can see in this x-ray, right? So here there is a mild injury to the soft tissue and as well as bone, but see the lump that it is forming, right? So what is happening here? The fibroblasts are accidentally replaced by the immature bone cells at the sites of injury. So here actually the fibroblasts should be replaced with the bone cells, but what is happening? They're accidentally replaced with the immature bone cells, so that is leading to formation of a hard lump or bump to develop within the muscle. So this is a gradual process and begins within a few weeks after the initial injury. So what are the symptoms? Symptoms include the pain worsens with time instead of getting better. Of course, in someone with this condition may also notice changes in the affected muscle, like they might experience increase in temperature, they might experience swelling, they might experience a lump or bump, and also a decreased range of motion in that part. Then coming to the oral manifestation. So what happens if the injury is happening to the bone tissues involving the face? So myositis involving the face muscles, particularly masseter and temporal muscles. Okay, masseter and temporal muscles are the most commonly involved muscles. Okay, so it has been reported in many occasions. So it is usually following a single traumatic injury. So there will be a difficulty in opening mouth, of course. TMJ, so masseter we know. So let us see, this is a mandible, imagine. So masseter is situated here, right? And this is having the attachments from the temporal muscle. We have seen that in the anatomy, right? So when it is involving masseter or temporal, what happens? There is a problem with the functioning of TMJ, right? So this will lead to difficulty in opening the mouth, with especially when there is masseter involvement. Okay, so coming to the diagnosis, as you can see the images here. So we use radiographs, right? So if it has been at least 2 to 3 weeks since the pain or other symptoms started, some imaging tests are used to look for the evidence of bone growth in the soft tissue. So the imaging techniques which we use are X-ray. So in the X-ray you can see the hard lump here. Then coming to the ultrasound, so ultrasound also you can see the lump here, right? Then CT, so CT we see in several planes, right? So CT is depicting like some soft tissue mass, hard tissue mass here. So these are the these are the imaging modalities which help in diagnosis. So but at least we need to wait at least for 2 to 3 weeks. Like we need to give the minimum healing period after the injury has occurred. Then only, if the healing is not proper and still the symptoms are persisting, then go for these modalities and then confirm the diagnosis of traumatic myositis ossificans. Okay. So the treatment. What will be the treatment? So mostly it resolves on its own. So once then taking pain relievers, of course, he is experiencing more pain, such as naproxen or ibuprofen, can help in relieving discomfort. Other things that a person can do at home include resting the area, icing, elevating the affected area, gentle stretching, wrapping the affected muscle with elastic bandage to reduce swelling. So okay, so these are the normal things which we do. So it will, by doing this, it will resolve it on its own. So surgery is usually indicated in cases with severe pain and growths that interfere with the nearby nerves, joints or blood vessels. Then there is very poor range of motion, like the affected part is not able to move properly, then it is and it is very difficult to perform the daily activities, then only surgical modality is recommended. So coming to the question they have asked in NEET MDS 2021 was, so a patient with history of trauma a few years ago presents with progressively restricted mouth opening. Most likely cause is, okay, so the most likely cause is trauma a few years ago. So it need not be 2 to 3 weeks. Okay, it is just the time frame which we keep to diagnose, the minimum time frame. So it can occur in a number of years back. Okay, so a single trauma, single injury has happened in this case. So we can arrive to the thing that restricted mouth opening. So of course ankylosis is also a very possible option for this, but since they have mentioned trauma as a specifically, we can arrive to the option as traumatic myositis ossificans. So ankylosis of TMJ can occur due to n number of reasons. It might need not be only of because of trauma. Okay. So if you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Docshala for dental content and at Docshala Medical for medical content. You can also find us on Telegram. Thank you.